Hi, everyone. My name is Doku Emmanuel, a medical laboratory scientist and a doctor of medical laboratory science student from Ghana. I'm presenting on the topic, should national healthcare systems in Africa fund genetic testing for rare inherited disorders despite their low prevalences? And I am for the motion, and I'm in group 6. So I'm going to start by saying that rare inherited disorders are genetic conditions that affect small percentage of population, but have impacts on individuals, and it's very devastating for family members especially. Now, some of the examples of the rare diseases that we have are the Down syndrome, we have the DMD, and then the cystic fibrosis, and the others. In Africa, these disorders are very much underdiagnosed, and there are several reasons. They can be due to limited awareness, and then lack of the genetic services, the labs and the tests, and then the prioritization of infectious diseases. In Africa, we think that, or it is known that infectious diseases are more important. So therefore, they are not being taken into consideration. Now, when you talk about the genetic testing, we are talking about tests that identify genetic mutations causing diseases. These tests allow for early diagnosis. They also allow for management and prevention of severe symptoms. Even though they are very low in prevalence, it is very important that the national healthcare systems in Africa are, or they fund this genetic testing, because genetic testing helps diagnose these conditions very early. They also lead to better management and then reduces long-term healthcare costs. They also support equitable healthcare access. So therefore, I stand for the motion and say that national healthcare systems in Africa should fund for genetic testing. Now, these are my reasons. The first thing I'm going to talk about is the ethical and human rights perspective. When we take into consideration WHO and then the human rights principles, no patient should be neglected due to rarity of diseases. Every patient is equal, must receive equal healthcare services. So therefore, as far as the person has a condition, which is rare or not, he or she is supposed to have equal and safe and better healthcare. So when you take into consideration some genetic diseases like Down syndrome, awareness have prevented discrimination. It has also improved healthcare support. So when these tests are being funded and they are being encouraged at a very early point, it means that we are going to have more knowledge about those particular rare diseases, and it's going to help us in all these aspects. Now, the medical perspective, the medical and scientific perspective, early diagnosis lead to better treatment outcomes. It also prevents symptoms, severe symptoms, and lifelong disability. It also supports precision medicine and targeted therapies. So, and when you talk about the health aspect or the medical aspect of genetic testing, we are able to get better outcomes from diagnosis. It also gives us overall ability on the symptoms and how to treat them. And then it also gives precision medicine. Now, as we have tested for the person's genetic conditions or the genes, we're able to know what kind of drugs, what kind of therapy would be best. Here, we are not going to go around the bush. We are not going to now do a try and error. But because of this kind of testing regimen, we can have a targeted therapy for the patients or the person having the disorder. Now we'll talk about the economic and cost effectiveness. Early genetic testing reduces long-term healthcare costs. It prevents unnecessary hospitalizations and then treatments. And then we have internal funding and partnerships that can offset some of these costs if it has been said that it is expensive. When you take into consideration cystic fibrosis for newborn screening programs, it has improved patient outcomes and then reduced the complications that we get mostly because of its effectiveness. Now, I want to talk about the healthcare impact. Now, when we encourage this genetic healthcare, genetic testing, it reduces misdiagnosis and then unnecessary treatments. It helps us in genetic counseling and family planning. So as far as we know each patient or each person's genetic condition, we can give counsel as to what they are to do in terms of planning for their family so that this disease will not proliferate. It also strengthens national healthcare data and then research capabilities. So having to fund this test, it gives us more data and helps us more in providing treatments. Now, the feasibility and then implementation can, I believe that it will be asked, how is this feasible? How can we incorporate genetic testing into our normal lives? Now, I am saying that this can be incorporated into maternal and child health programs. We already have existing healthcare programs. We just have to add it up. We can also pilot these programs in high-risk populations. So if we found out that, okay, so there is this population that are prone to Down syndrome, we can make it a point, integrate it into their testing regimen, the genetic testing forms, so that we will be able to get data from them. So it is very, very much feasible. We can also collaborate with private organizations and global health initiatives to be able to make this feasible. I believe and I know that my colleagues on the other side will say that why should we consider diseases or disorders that are very rare and leave the ones that are important or that are very much on the streets? Now, I want to say that healthcare is not about competing. We are not competing. We are saying that there should be investment in genetic testing that will complement the already existing test. So therefore, we are not saying that they should leave the other ones, but I think that we should find a way to incorporate genetic testing, because these rare diseases are very uncommon, but when it comes together collectively, they are significant and then it creates more severe morbidities. Now, if we are able to also diagnose them as early as possible, it will prevent misdiagnosis. Then also we will not need unnecessary treatment, and then the long-term complications will not be dire. Now, the economic sustainability aspect, this genetic testing thing is a long-term investment. The cost of genetic testing is now decreasing with advances in technologies like the next generating sequencing and then the PCR. Now it's on this, it's in the market. It's not expensive like it used to be. So the economic part cannot stand. It cannot hold water now, because now the tests that are available, the technology that is available are very much less expensive. Now, the precision medicine aspect, also helps us in the long run by not trying and testing other regimens that are not going to work. When we know in everybody's genetic condition, we can allocate a very specific targeted medicine. So we are not going to spend a lot of money wasting them out and all that. We know that the drug we are giving out is going to work specifically for a particular person. So it will not be that costly. Unlike when the person waits until he's having severe symptoms before you have to go and do so many tests and give so many drugs, which may not work and all. Now, in the infrastructure gaps, this is why we are supposed to invest in genetic testing. Africa is already investing in molecular diagnosis for infectious diseases. So in 2019, 2020, when this COVID-19 thing came up, we found it very important to invest in PCRs and molecular diagnosis tests. So it is not going to be a very much big or huge infrastructure gaps, because we already have the settings, we already have the capacity. There are more scientists and all that can do this testing. We just have to build their capacity and strengthen them in the overall capabilities of the diagnostic test. So right now we have the human resource. We just have to strengthen them in that aspect, and then they'll be able to do fine. Health training professionals will be able to mitigate misinterpretation and then ethical dilemmas, because that is their field, that is what they've been taught to do. Now, when we talk about the ethical and social concerns, it addresses discrimination and awareness. When we get to know that this person's situation is different, there's no way we are going to have discriminate because we have knowledge about it. It is when we don't have knowledge or we are not aware of a particular disease, that is when the discrimination comes in. But as far as we know about it, as far as we know that this is as a result of this, we can deal with it. So policies can protect individuals from genetic discrimination. Psychological support can accompany testing to provide informed decision-making and genetic counseling. And then public awareness campaigns can also integrate genetic literacy into healthcare education. Now, the other part that my colleagues are going to talk about, they are going to talk about limited treatment options. But we know that knowledge is power. Even if treatments are limited, genetic diagnosis enables better disease management and family planning. Identifying genetic risk supports research and development for future treatments. So having to do this more often will give us more data to be able to develop treatment regimens that we need. So early detection can improve the quality of life through the lifestyle modification and then targeted interventions. So the data limitations, this is why we will need to do this, because as much as we do this test, we will get more data to support and then expand all these genetic diseases and its treatment. Now, when you talk about the alternative approaches, it's not mutually exclusive. Strengthening primary healthcare and investing in genetic testing can be done hand in hand. So you cannot say that we cannot do all together. No, it is all important. We can do all together. So genetic conditions are often misdiagnosed as common diseases. So the testing improves this diagnostic accuracy. All right, so in my closing remark, I want to emphasize that funding genetic testing is an investment in healthcare and equity sustainability, because the United Nations, the WHO all believe that everybody has equal rights to accessing healthcare. So therefore, early diagnosis saves lives and reduces long-term costs. African policy makers should prioritize genetic testing funding, and then every life matters. No patient should be left behind. So below are my references. Thank you. If you have any questions, you can ask me.